you, Dr. DeGioia, for inviting me to speak today in the Innovation Center. It's an awesome group. I'm not a public speaker, so my first disclaimer will be that I am nervous.
Pull the microphone.
Don't even know how to talk into a microphone. Clearly, not a public speaker. My second disclaimer is that I see there is a video recording, and so to anybody who's watching this, the camera does add at least 50 pounds. I'm very, very skinny in part. So I'm going to start. So my story really starts with my son Tyler. Tyler's a 16-year-old teenager, typical teenager, and he was had a healthy childhood. He was very active, played almost every sport, and the only thing that was a little bit different about Tyler is he never really ran correctly. He never had the normal run, heel-toe gait run. As a matter of fact, from the time he could play organized sports, his nickname was Ducky. It's stuck. We still call him Ducky. And he kind of ran, waddled, and never very fast. And we couldn't quite figure it out. The doctors weren't overly concerned. We just kind of figured that's who he was. In 2009, he started an organized sport, junior high basketball, and he developed very quickly. He had a lot of pain, a lot of swelling in his knees and ankles. We were very concerned. I was an OR nurse at the time by trade, and of course, I believe that most surgeons can fix anything. So we sought out different doctors. We had multiple doctor appointments, and I will tell you, it was extremely frustrating. During that process, we did realize that Tyler had a hypermobility of his joints, so his kneecap kind of floated back and forth, so that was part of the problem. And we sought out different, a lot of different type of avenues, such as physical therapy. Really nothing helped. The pain got worse. He went into depression, quit playing sports. He was made fun of at school. It was really disheartening to watch him, this wonderful class president, just kind of fall down to really nothing. He stayed in bed most of the time. His knees were so swollen on most days that we had to carry him into the shower to kind of decrease that swelling. We were referred to Dr. Paul Rosen at Children's Hospital. He was the chief of rheumatology at the time. And on the way to Children's, that last appointment, the first appointment, Tyler said to me, "Mom, I'm sick of seeing the doctors." He said, "This isn't going to work, nothing works." And I said, "Let's give it one more try." So we went and we met Dr. Paul Rosen. He was quickly diagnosed with RND, which is reflex neurovascular dystrophy. And if anybody knows the process, it's very, very painful. It's kind of one of those diseases that are ruled out. You rule out everything else, and then you're established with RND. Tyler, RND, just to give you a little bit of the background, RND is it's a disease process that the nerves do not turn off in those areas. So he has this pain that is chronic pain that just he has to learn to deal with it. Dr. Rosen quickly sent us to the Children's Institute. We started this intense physical therapy program, and we became patients of Dr. Rosen. Some things that we noticed right off the bat that was uniquely different about the experience with Dr. Rosen in his clinic. The first time we went to see him, he approached Tyler. He asked Tyler questions. He wanted to know about his pain level. He wanted to know about his history. He really didn't talk to me. And, at first I was kind of taken back a little bit. Hey, I'm the mom, I know everything. But he didn't want to hear about it. He wanted to hear from Tyler's experience, which, I look back now and how incredibly excellent. The second unique process that Dr. Rosen kind of went through was he asked Tyler how he liked to be communicated to. Did he email? And Tyler's like, "No, I don't email." And he said, "I see you got a cell phone, buddy. Do you text?" He's like, "Yeah, I text. I love texting." And he said, when you have a flare-up or when the pain's intense and you're not quite sure what to do, he's like, "I want you to text me. I want you to tell me about your day. I want you to text me." And dumbfounded. Have you ever had a surgeon who, a doctor who said, "I want you to text me"? Great. He loved it. He texted him. One of the visits, Tyler talked to him about his concerns. He's really depressed. His friends don't understand. They can't see his disease. They don't understand why he's not playing basketball anymore. They don't understand why he misses school, or he kind of, needs help walking up the stairs at school. And so he said, you know what? He said, I will tell you that some of the other teenagers with the same disease complain about the same thing. So he put together a YouTube video. And as you know, you can see anything on YouTube. I just watched a YouTube video on how to cut up a hot tub with a chainsaw. Like, I don't know why somebody would make that video, but it's out there. So clearly, this is the mode of communication for teenagers. Incredible. So we watched this YouTube video, and it really just kind of reached out to Tyler, and he got it. Here's his doctor explaining to him and his buddies why he has this disease, and how, what happens and what it looks like, and why he's a little bit different than everybody else. And through that YouTube video, he connected with other teenagers across the country that have the same disease process. And so he started going to an arthritis camp with other kids with RND, and just really reaching out. And we reached out to an RND community, and it really came back from Dr. Rosen. So I said to Dr. Rosen, what is going on with you? Why are you so different? Why are you so unique? And he said, Hope, I practice patient-family-centered care. He said, I learned this from, Dr. DeGioia and the Innovation Center. And he said, I have a working group in our clinic at Children's Hospital. And I was amazed. I said, whatever you're doing, don't stop. Keep it going. Tell everybody about it. And he said it works. So I will tell you that I had an opportunity to apply for a job at Children's a year later. And I'm actually the unit director in same-day surgery in our recovery room. And so I was approached by Dr. Burns, and he's a pediatric surgeon, and he asked me if I would be interested in learning about patient-family-centered care. And I said, Dr. Burns, I'm on board. I know about it. It's done wonderful things for my family. So we started the perioperative working group. We are spreading the methodology to the surgical inpatient units. And I will tell you, it's really helped me. It's helped my family. I'm raising a healthy teenage son, as you can tell most days from my slide. He's a little camera shy. But I encourage you to use this methodology. I encourage you to take it back, and I encourage you to use it every day in your family's life and in your professional life. And I can't say enough about it. So this is Tyler today. This is actually last week I took this picture. He's adjusted his life a little bit different. He's teaching a buddy of his how to archery hunt. So he uses a lot of upper body strength now. Still has pain, still works through it. He golfs. He's horrible at it, but we won't tell him that. And he hunts, and he's especially, he's a really great bow hunter. So I wanted to show you this picture. He's doing great today. So thank you for letting me share my story.